us. Let's welcome in the Narayana Health Management. They reported a strong performance in Q1, highest ever quarterly revenue in Q1. And Sandhya J is Group CFO at the company, is now with us. Sandhya, good morning. Always a pleasure having you on the numbers. Just a quick word, Sandhya, on margins. I think at the end of the fourth quarter, you said margins should stabilize around 25%. For Q1, just under 24%. Stick with that number overall, 25 for the year?
Good morning. Thank you for having me here, and it's always a pleasure. So our margins story is a sum of the parts kind of story. I think we are still trending quite healthy in terms of our hospital business margin. We have expanded the domestic business margin by about 70 bips, and Cayman has been fairly consistent. Now, the reason we are seeing this dilution in the margin is because we are investing in our integrated care business. So the total between India and Cayman, the total dilution in the margin that has come from the integrated care business is almost 28 crores. The positive part is that it has given a very healthy addition to our revenue portfolio. So we've added about 59 crores of revenue from that book of business, but that is causing the dilution. So we're still holding that our margins will be consistent, but we will have this little bit of dilution coming in from the integrated care business until the revenue catches up to the fixed costs that happen with every new business.
Hi Sandhya, good morning. Good to see you. In integrated care, at what level then of revenues does it start breaking even? I missed that point. What was the revenue in the past quarter?
For the integrated care business,
yes.
For Q1,
yes.
we've about 59 crores of revenue we've generated between India and Cayman.
Okay, and at what level does it turn, EBITDA accretive? As you said, at any business, as you venture into it, it takes time for it to break even. There is some fixed costs. So at what level does all of that cost break even and comes up to speed?
So we are looking at a horizon of at least 2 to 3 years, because the way the integrated care business works is that it's a cohort model. Each clinic breaks even at about 18 months time frame, but then we are adding new clinics. So which means that while we have broken even in one segment of business, there are new clinics which are coming on and which are going to be burning cash. So in all, from an India point of view, we have set aside about 450 crores for the integrated care business, 400 to 450 crores. Now, it will take 2 to 3 years time for it to be in a state where it is coming to break even, not because individual clinics are taking that much time, but because that we will keep expanding also and investing behind this vertical.
Okay, all right. No, got that. Sandhya, so I know it is, actually it is too early, right, to ask you about what kind of, on pricing. I mean, you take that one hike beginning of the year, which we saw in January, too early to ask about next year. We're just beginning H2 of this year. But I mean, is the pricing environment stable for that 8-10% kind of a price increase? You know, the big fear, Sandhya, is that hospitals as a business, right, overall, has continued to do very well. And there is strong demand for quality healthcare, etc. But a lot of investors, there's only one concern, which is, of course, valuations and the price you pay for when you're buying these companies, these stocks. The other one is, at some point, will the government step in some way with regards to pricing? And there's so much angst, right, on social media, etc. Narayana, of course, is at the lower end of the pricing, etc., compared to other chains. So absolutely acknowledge that. But, you know, and by the way, it's not new, right? A couple of years back, we had that in parts. There was some standardization of these costs, etc. Never really went anywhere. In any case, health is a state subject. Any thoughts you can offer, Sandhya, on this?
It is a very delicate subject, like you rightly say. But the fact is that there are a lot of costs to cover. I think somewhere that perspective also we need to understand all our equipments are imported. And we have the foreign currency impact also which come. And healthcare is a very manpower intensive industry. So we take impact of minimum wages, we take impact of annual escalations, and of course, we do try to automate and simplify, etc. But still, it's an extremely labor-intensive industry, and that cost pressure comes. And for larger hospitals like us, we also have significant costs which go into infection control, which go into quality, which go into maintaining a standard of care, which is at international levels. That's why India is an international tourism destination, because of the quality of care that India offers. So it is not a very straightforward understanding that because people are more ambitious in terms of their margin expectation, and that is the reason why the pricing pressure is coming. The pricing pressure is coming due to a multitude of factors. The other aspect we need to see is that the industry cross-subsidizes a lot. For example, 35% of volume of the patients we deal, maybe by value it is about 19%, but by volume it is about 30-35%, are on government schemes, which are extremely subsidized. Our price recovery on these schemes may be less than half of our price recovery from the other customers. So some amount of cross-subsidization effect also comes in the industry, which is in a way good, because the people who use the government schemes come from segments of the society who cannot afford care otherwise. So therefore, it's very nuanced, this topic of cost of healthcare. And even I cannot comment on whether the government will intervene or not, but any intervention has to take this holistic picture into perspective before any action is taken. Just coming back on the question you asked about our own price increase, we take low single-digit price increases, which of course we took in as on 1st January. Though we've seen a healthy RPOP growth, mainly because we lost our Bangladeshi volumes, which was a low ticket price business for us. So those were reasonably discounted procedures. And because we're substituting them with a little bit of domestic volume, so some amount of positive mix impact has come in. That's why we have seen a reasonably healthy growth in our revenue RPOB and revenue per patient. But overall pricing, we have to see how it evolves. And
yeah. Okay, all right. Sandhya, no, absolutely. Very, very important subject there. And thank you for your views and your perspective on that. Good luck with the rest of the year. So that's the call coming in from Narayana Health.